So ibuprofen is used to treat fever, mild to moderate pain, and arthritis. It also can give relief for women who are having PMS. It is also highly effective in promoting closure of the ductus arteriosus in preterm infants, and that is when they're little in utero. Your pulmonary artery and your aorta have a very tiny short blood vessel that connects those two, and it's open only in the developing fetus. So if the baby is born and that did not close, and you may see that because they have poor eating, failure to thrive, or breathlessness, then they can give them an NSAID which promotes that to close. So that is another use for it. It's usually well tolerated in individuals taking it, especially if you don't have a history of peptic ulcers or gastric bleeding. It produces less gastric bleeding than aspirin and in less inhibition of platelet aggregation. So it's one of the safer NSAIDs. It can, although in rare cases it can cause Stevens-Johnson syndrome, and it does pose a threat of a heart attack or stroke. Now, according to Davis, the action, it inhibits prostaglandin synthesis. You want to be very careful to avoid after 30 weeks gestation because it may prematurely close that fetal ductus arteriosus. In peds, preterm neonates with untreated infections, congenital heart disease, talking about that PDA again, you really want to be in necronizing enterocolitis or severe renal dysfunction. Kids like that don't need to be taking it. There is, you want to use it cautiously, of course, in cardiovascular patient because it may increase the risk of cardiovascular events, renal or hepatic disease, dehydration, or patients on nephrotic drugs because it could increase the renal toxicity. Also, if aspirin triad patients, which is asthma, nasal polyps, and aspirin intolerance, it can cause a fatal reaction, so you want to be careful in those. Remember, kids under the age of 6 do not get it. And the side effects that we generally see are headache, constipation, dyspnea, which is like heartburn, nausea, vomiting. It is can be known to be hard on the kidneys, the renal. Okay, what we want to, as you're assessing, if they have asthma or aspirin-induced allergies and nasal polyps, remember they're at increased risk for developing a hypersensitivity to this. So you also want to be watching for signs and symptoms of GI bleeding, which is tarry stools, lightheadedness, hypotension, renal dysfunction, which would be elevated bun and creatinine, and decreased urine output. If it was a hepatic impairment, you'd see elevated liver enzymes and jaundice. You're assessing patients for the rash just because you're watching for the Stevens-Johnsons. You're assessing their pain because that's what this is for. You're monitoring their temperature, and if it's for PDA closure, you are watching for signs of bleeding, infection, and decreased urine output. So if they are administering more, if they're taking more than the recommended dosage, that is also, it may be increasing their pain relief, but it also increases the incidence of side effects. So you want to take the lowest dose possible. You should be well hydrated to prevent renal adverse reactions. You should, for a rapid initial first effect, and when you're taking it PO, you should be taking it 30 minutes before or 2 hours after a meal. You can take it with food to decrease the GI irritations. If you're taking it for help with menstrual cramps, you're going to want to take it after the onset. Taking it before hasn't been shown to be effective. For teaching, you want to teach patients to take with a full glass of water and remain upright for 15 to 30 minutes. That's to decrease the chance of them getting dyspepsia. It may cause drowsiness or dizziness, so until they know for sure, just don't let them drive. You don't want to take over-the-counter ibuprofen for more than 10 days or 3 days for a fever. You just want to, you just want to check with your doctor if that was the case. And caution patients that the use of ibuprofen with 3 or more glasses of alcohol per day increases the risk of GI bleeding. And you want to advise parents and caregivers not to administer ibuprofen to children who may be dehydrated, which can occur with vomiting, diarrhea, or poor fluid intakes, because dehydration increases the risk of renal dysfunction.